anywhere on your body can really put a damper on your life and your activities. But when it's somewhere that's constantly in use, like your pelvis, it can truly be debilitating. Dr. Rodolfo Gari from Florida Pain Relief Group joins us now with more about this. Dr. Gari, good to have you back.
My pleasure.
So many women that I know have pelvic pain, and it really is awful for them, and they do not know where to turn. How many times do you have somebody come through your office door and they say, pelvic pain is driving me crazy?
Just about every day.
And what in the world can be causing this?
Well, pelvic pain can be caused by a host of a variety of different factors. Sometimes these women may have some sort of endometriosis. They may have adhesions. They may have a different, some sort of a strain. So there's all kinds of different disorders that can be causing this, and unfortunately, most of the treatments that are out there are just not very good. A perfect example is adhesions. Mm-hmm. So if you have adhesions...
What is that?
So adhesions are kind of like almost like a little spider web, if you will, but it's your own body spider web.
Okay.
So like a little scarring sometimes inside, but it's inside your abdomen, your pelvis, so it can be pulling on the nerve or pulling on one of the organs there. It can be causing pain. So what a surgeon can do is go in there and actually through what's called the laparoscopy, go in there with a scope and remove those adhesions, and you feel much better. Here's the problem. Most of the times it comes right back.
Okay.
So it becomes a fetal event to continue doing that. So we have to make sure that, hey, you know, has everything been done that can be done? And then let's look for some alternatives to doing the same thing that hasn't been working. And some of the things, for example, that can be done, there's a nerve block called the superior hypogastric plexus block.
That sounds very scientific.
Yeah. So basically, your pelvis has a bundle of nerves called the superior hypogastric plexus, and that's where you get the pain sensation. So something very simple that we can do is go in there and actually place a long-acting local anesthetic, maybe a little bit of a steroid into that ganglion to help calm it down. And there's a whole bunch of different techniques like that we can do. There are other things that we can do for patients that are at the wit's end. There's nothing else that can be done. We've actually performed spinal cord stimulation that stimulates the pelvic area.
Really?
So instead of pelvic pain, you have a much more comfortable sensation where it doesn't bother you anymore.
I'm thinking there are women out there listening, they're thinking, well, what kind of a time commitment is that for me? Do I have to come back every week to get this stimulation so that I feel better?
No, this actually, first we can do a trial, see if it's going to work for you. So you'll have that little trial for about a week. Make sure there's something that you're comfortable with and it helps you. And if it does help you, we can get it implanted. Okay. It's a tiny little electrode, maybe the size of a string. It goes into the back of your spine. It stimulates those nerves, and then there's a little generator that gets implanted under your skin. It's about the size of $50. Wow. And that battery lasts several years. You can program that in different ways, and you have a lot of control over yourself.
So lots of options out there.
Absolutely.
Okay, Dr. Gari, thank you very much. You can contact Florida Pain Relief Group to schedule your same-day appointment. Stop living with pain. You don't have to. You can visit their website. It is floridapainreliefgroup.com, or give them a call, 844-KICK-PAIN. We'll be right back with more Daytimes. Don't go away.